Lara. I'm a conference producer at SA Media Group's AI and Drug Discovery Conference, which will be held the 21st and 22nd of October in Boston. And today I'm delighted to be joined by one of our esteemed speakers. This is Stephen MacKinnon, the VP of Applied Machine Learning at Recursion. And he'll be speaking on industrializing drug discovery through an ML-first mindset at the conference in October.
I oversee our production machine learning systems that see the development of our drugs all the way into the lead-up stages of drug discovery. That is all the parts of the process in which we have machine learning systems, how those machine learning systems interact with one another in order to create better medicines. This year, we've seen a lot more advancements in, say, the abstraction of information. We're no longer really thinking of our experimental workflows and our experimental workflows and our public data sources so much as a curated set of information that's human readable anymore, but rather those are getting more and more abstracted. So that they're not necessarily optimized for human consumption, but that they're more optimized here for machine learning consumption. Just the other day, I was going through the Uniprot website and noticed that Uniprot, which used to download these files that were human readable, now have an option for downloading embeddings, right? So where every gene is just kind of represented by this vector that obviously you look at that and you don't really put much context to it, but allows you to dig for new relationships. So more and more we're seeing the abstraction of data, right? Like we're not generating data and processing it for human consumption, but we're taking the data almost in its original state and processing it for machine consumption. And this is definitely on path towards multimodal systems, systems that integrate different forms of information in different ways. So that's likely to be one of the big trends in terms of starting to reframe things as ML problems rather than reframing things as human research problems. ML is being used not necessarily for individual point solutions at different phases of the drug discovery. The solutions that we need to build need to start speaking to one another, right? So if I were to rewind, maybe 5 years or so, there were a lot of startups in this space. A lot of them were looking at one or two individual points, coming up with a few different models and trying to optimize a particular phase of drug discovery with a specific model. Now, as we're kind of progressing and we're putting machine learning at all the different phases together, like the systems in which ML is done, the systems in which ML operate have to be consistent. They have to be able to see one another so that we can be thinking more end to end. So there's been a lot of emphasis on developing our technical stacks to facilitate the continuous development of ML models, for there to be consistency in terms of how the models operate and how the models can be referenced. So getting to the stage where there's over 100 different production models that do different things, it's really important to start having some consistency between how all of those operate. Along those same themes, really we're thinking about data generation, right? We're thinking about generating data for the purpose of ML as opposed to generating data in order to get to the answer as quickly as possible. And sometimes there's a barrier to get to that point. As we're being more abstract with our data, it opens up more possibilities as to how we collect it, how we scale our data generation capabilities, and what experiments we choose to do, right? Sometimes the experiments that we choose to do to convince ourselves are not the same as the experiments we would do to convince a machine learning agent that this is the particular path to take this program, or that this is the next thing that we need to do to de-risk systems. So I really think that we're at the stage now where we're starting to ask the machine questions. We're starting to ask the machine, what is it that you want to see? And really, like, that's really remarkable compared to where we were 5 years ago, I would say. This field of AI-driven drug discovery has grown quite a bit. It has evolved tremendously in the last 5 years. Seeing how this narrative is evolving, how people are changing the way that they're thinking about things. These are the types of connections that you get from talking to other people, from seeing talks, and being there, being in the moment. Love to hear a lot more about what's happening in the big pharma companies, what's happening in the startup space, how people are changing their mindsets, and how people kind of envision not necessarily what's happening today, or what today's drug discovery systems look like, but I want to know how things are going to look in 2025. I want to know how things are going to look in 2030, right? And that's what you get from being on site and speaking to the leaders.
Absolutely. Well, yeah, hopefully we can get in some of those conversations at the conference in Boston in October. And thank you so much. We can't wait to hear more from you and from all the other speakers at the AI and Drug Discovery USA conference, the 21st to 22nd of October in Boston. We hope to see you all there.
All right, thank you. See you there.